talk today is about sexual optimization. It's about using integrative and regenerative treatment options and strategies to promote sexual longevity and peak performance. I gave a similar talk in Italy about a year ago for Mind Valley, which was great, and it ended up on YouTube eventually, and it got a lot of views, which was also great. So before this talk, I decided to go back and kind of revisit that talk, and I watched my YouTube video, and I kind of critiqued myself, and then I made the mistake of reading some 800 or so comments after the YouTube talk. But it was, it's actually really good. I learned a lot of things in reading the comments. I learned a lot of things about myself, actually, that I didn't even know. For instance, I learned in the comments that I am both a rigid prude and a slutty nymphomaniac. Somehow, both. I learned that I am an anorexic vegan who has good arms but bad posture, so I'm really trying to work on my posture today. I learned that my hair looks like it got stuck in a lawnmower, so I wore my hair in the same way so that I could just kind of show you guys. And my favorite was that I learned that it was people like me, fast-talking, man-hating, sexually deprived feminists like me, who were killing sex for the rest of you. Which, honestly, my first response was, wow, I didn't know I had that kind of power. But what I really took away from all of those comments is that people are passionate about sex. Maybe they're a little bit possessive and a little bit proprietary and prickly, but they're passionate. This talk, by the way, that I'm mentioning was a talk about sexual health. So it was mostly about blood flow and nerve conduction and things like this. I can't imagine if I'd given a similar talk on brain health or cardiovascular health or pulmonary health that I would have gotten quite the same quantity and caliber of comments. But sexual health and sex strikes a chord, and it's powerful in ways that many other things are not. So what if we could use the power of sex? What if we could harness the power of sex to make us healthier? What if we could use sex and people's inherent desire to continue to be able to have sex as an entry point for creating health and wellness? I believe that we can. In fact, I see that every day. You see, I've discovered this secret door. I call it the sex portal, which I think sounds maybe a little bit racier than it actually is. But the sex portal is accessed when a patient comes to me with a sexual complaint. And then as we kind of dig into their medical history, we learn and we find that it's not necessarily a sex problem as it is so much a health problem. So for example, I'm going to give you some examples. These are not actually the patient's names, so don't get worried. But I had a patient come to me. His name was Seth. Sort of, that wasn't his real name. But Seth came to me, and he was having some erectile dysfunction. He was having a hard time maintaining erections. And he was pretty young. He was in his mid-30s, so this was really disturbing to him because he was generally pretty healthy. So as I'm diving into his history and physical, I learned that Seth has been a pack-a-day smoker for 20 years. He's been smoking since he was 15, and he had tried to quit, but he couldn't really quit. And so I counseled him and said, basically, there's a good chance that the smoking is contributing in a major way to your erectile dysfunction. And eventually he was able to quit. And all of a sudden, in answer to this sex problem, Seth reduced his risk for everything from heart disease and stroke to Alzheimer's disease and lung cancer. He sort of stepped through this sex portal, and he came out the other side a healthier human being. Another patient, Pam, came to me, and she was having some vaginal dryness. And so she says, what can you do for my vaginal dryness? And I sort of stepped through this sex portal with Pam, and I learned that she's postmenopausal and that she hasn't been taking any estrogen because she'd heard it was bad for her. And by the way, her skin is thinning, her brain is foggy, she's having a hard time making decisions, she's gaining weight around her belly, which has never happened before, and she's having mood swings so severe she feels like she's literally going crazy. So her problem is not a sex problem, it's a hormone problem. Ned came to me. Ned was in his mid-60s. He came in saying that his Viagra wasn't working anymore. So he'd been on it for 10 years, and it had always been really reliable, and all of a sudden in the last few months it really hadn't been working that well. So again, walked through the sex portal and learned that Ned is a daily user of antiseptic mouthwash. And he's a daily user of acid-blocking medications. So this means Ned cannot make nitric oxide from food. And because of his age, and because he's also not making it in his blood vessels, he doesn't have enough nitric oxide. And medications like Viagra require that you have your own nitric oxide in order for them to work. And by the way, he also had increases in his blood pressure and poor gym performance and increased triglycerides. And this was all because his nitric oxide levels were low. So again, not a sex problem, a nitric oxide problem. My last example is Mary. So Mary came to see me because she was having a hard time orgasming. In fact, she had never had an orgasm. She was in her mid-40s, had 4 kids, happily married. And she came in and said, "Can you do a procedure, and can you fix me?" And so again, I kind of walked this well-trod path of the sex portal, and I realized that Mary is under tremendous stress at home. She's taking care of a disabled child, doesn't have a lot of support in that, so she's super stressed out. And because of this sort of religious upbringing that she has a ton of guilt about even having sex. And she's never done any sort of sexual self-experimentation for the same reason. She has always felt super guilty. So, Mary didn't have a broken clitoris or a bad vagina. It was much more complex than that, and it required looking at all the forces, all of the things that were contributing to her sexual health, her mental issues, her emotional issues, her spiritual issues that were coming in and contributing to that. So in all of these cases, patients came in with a single sexual complaint. But the problem wasn't in the genitalia. The problem for these patients was a systemic problem that was accessed by going through this sex portal. And it was accessed because we were able to dive in and really get a good history from these patients. And because we did that, and because the patients were interested in investing in their health, because they were interested in investing in their sexual health specifically, we actually saw improvements in not just their initial complaint, but much further reaching improvements in their general health. So let's take a look at this is my sex portal. So this is, here we are, we're kind of walking through. And this is what I see when I walk through that sex portal. Now, I have sexual health as being right in the middle. And that's not necessarily because it's the most important thing in the universe, or it might be. But the reason it's there is because I want you to kind of see the relationship between sexual health and the other 6 main components of health. So those main components of health, as you can see, are mental health, environmental health, emotional health, spiritual health, social health, and physical health. And these are kind of accepted as the 6 main components of health. So in order to have optimal sexual health, you have to have positive input coming in from all 6 other areas of health, which is pretty cool, I think. What's even more cool is that sex gives back. It's kind of like trickle-down economics. You guys know what that is? People who are not from the US. Except in this case, it's not really trickling down. I see it more as sex and the energy of sex is kind of bursting out and giving back to all these other systems around it. So a few years ago, I was in a yoga class. And I was pretty new to yoga, and the teacher had us doing this one-legged, twisty legs around arms, kind of sideways pose, and it was very hard to hold. And I remember that she said to everyone, she said, "Okay, class, I want you to channel your sexual energy. Channel your sexual power and bring it up from your pelvis into your belly, and bring that power up into your chest and out your arms and legs, and bring it up into your head, and then shoot the power out of your third eye chakra." And I remember at the time, I didn't know what a chakra was, and I didn't know why I had an additional invisible eye in the middle of my forehead. But the other thing that she said at the very end was she said, "Use that power to find your balance." And I remember later thinking that I loved the idea that my sexual energy and power was literally radiating up into my body, and that I could shoot it out of my head like a laser beam into the world around me. Now, I'm not sure that that's exactly how it works. It may or may not work like that. But I do think, and I can tell you for sure, that the benefits of sex and sexual health exist well beyond the bedroom walls. And I'm going to go through kind of each system here. So for emotional health, we know that couples who have a healthy sex life, or people who have a healthy sex life, have less depression, they have less anxiety, they have better self-esteem, and they have less insecurity. From a mental, intellectual standpoint, we know that sex can stimulate the hippocampus, that the oxytocin that comes out of orgasm can increase neurogenesis, increase new nerve formation, that older couples, men and women, who have more frequent sex or regular sex have been shown to have less cognitive decline, and less memory loss as they get older compared to their peers. We know that on a number of different levels and for a number of different reasons, sex can decrease stress and your response to stress. And that's having to do with all different hormones and all different things, but it's a very real effect on stress. From a physical standpoint, we know that sex does all kinds of good things. And you've probably heard some of these things. Sex can improve your immune system, so it can help you fight infections. Sex has been shown to improve your sleep. It can decrease your pain. There are actually studies in people who have chronic pain, like chronic headaches, chronic joint pain, that have shown that when they're sexually active, they have less pain than when they're not, which is amazing to me. Sex has been shown to decrease blood pressure in multiple studies, reduce the risk of cardiovascular disease as well. There was a study in women that showed that at least an association between an active sex life and longer telomeres, which you biohackers will appreciate. And there have been several studies in men that have shown that an active sex life seems to be associated with a significant improvement in mortality. There was one study, for instance, that said that at a 10-year mortality in men who were sexually active having sex at least once a week was half that of men who were not sexually active. Now again, there's a lot of things that could play into that, but it's interesting, it's fascinating. What about spiritual health? Whether or not sex causes you to see God or not, there is definitely a connection between sexuality and spirituality. Certainly, many of the Eastern traditions, like Kama Sutra and Tantra, talk about having to master sexual energy in order to develop spiritually. So this idea of sexuality and sexual health influencing spirituality, I think, is not far-fetched. And finally, on a social level, we know that couples who have more frequent sex they're closer and they are happier. They tend to stay together longer. In fact, when patients come to see me with sexual dysfunction, they don't complain that their blood pressure has gone up or their immune system is not working very well. What they complain about every single time is they complain that they feel disconnected from their partner, that they miss feeling connected. And to me, this is a really big deal. Because we live in a world where loneliness and disconnection is killing as many people as cigarettes and obesity. We live in a world where 20% of marriages right now are sexless marriages. And 17% of millennials, which is a lot of you guys, admit to checking their cell phones during sex. You should not do that. So many of us are just starved for human connection. We're starved for these deep connections, and sex offers that opportunity for those types of connections. It offers an opportunity to sort of exercise our humanness in a way that few other things do in this sort of time and world that we live in. All right, so now we kind of know the why. Why care about sex? Why care about sexual health? Certainly, sex is pleasurable, and I would never discount the pleasure piece of it because it's so important, but it's also very good for you. In fact, if you can imagine that there was a pill that did all the things that sex does for you. The drug companies make it, and they're selling it, and it's a multi-billion-dollar pill. It would be a pill that we would all want to have, right? We would carry it around in our pocket all the time, or like our backpack, or our purse, or our fanny pack, or whatever we're carrying. We would have that pill with us because we would want to have it with us all the time. And yet, you do have it with you all the time. The only thing that I can think of that is similar is exercise, which obviously has a lot of benefits similar to what sex does. But some people would agree that sex is maybe more fun than exercise. But what if it's not? What if it's not fun? Or what if you can't have sex the way that you'd like to? Sexual dysfunction is incredibly common. As I look out on this room, I guarantee that a number of you have some degree of sexual dysfunction. It's something we don't really talk about, but I think that we should. I know that 40% of men over the age of 40 have some degree of erectile dysfunction. That number goes up 10% per year, so 50% of 50-year-olds, 60% of 60-year-olds. You guys can do the math. This is a real problem. And it's not just older men. I see younger men in my practice every day, men in their 20s or 30s who have ED. Although, of course, it's more common in older men. This can happen at any age. So this is very common. Women, we know about 40% of women at any point in time will complain of sexual dysfunction if you ask them. This could be problems with libido, problems with arousal, problems with orgasm, or problems with pain. But it's incredibly common in both men and women to have some sort of sexual concern. And the most staggering number to me is this one. 75% of men with sexual dysfunction, and at least that many women, are currently untreated. Many of them probably haven't even asked for help. So it's a big deal and a big problem. I recently connected with this lady named Alexandra Drain, who runs a group called the ELIZA Group, which is a health research group. And I had heard a talk of hers a couple of years ago at an exponential medicine conference. And her group was trying to figure out why people who have access to health care are not getting the health care. Why are they not going to the pharmacy to get their blood pressure medications? Why are they not following up with their colonoscopies? Why are they not going to see their PCP when they have an appointment and a doctor and it's paid for? Why are they not doing this? And what they found is that people have these stressors in their lives that are so stressful and so tortuous that it sort of takes all of their energy, and it causes them to sort of bury their head in the sand when it comes to their health. It causes them to neglect their health. So what are those stressors? And this was fascinating to me. The number one stressor was money concerns. And that makes sense. People who don't have a lot of money, they tend to neglect their health because they're worried about money. The second most common stressor that causes people to neglect their health was actually an unhealthy sex life. And the third one was relationship troubles, which also could be influenced by sex. So this is a big deal. We know that having sex and having a healthy sex life can make you healthier, and now we know that having an unhealthy sex life can actually make you less healthy. So what can we do about it? I have here 7 strategies that I've kind of put together, things that we can do using integrative and regenerative treatments or therapies or ideas to try to promote sexual optimization, to try to promote sexual longevity. So the first one is mind your mind. This one is fairly intuitive, I think, but most of us know that our brain is our biggest sex organ. It's where desire starts, and also for many of us, where desire dies. And stress is one of the main things that I see in my practice as causing desire to die. So I talk to patients a lot about stress and how it's affecting their erections or how it's affecting their orgasms or whatever. And I use the analogy of the tiger, the saber-toothed tiger cortisol analogy. You guys have probably heard it before, but I'm going to give it again. So we talk about how, in the old days, the caveman days, people would have occasional stress. They would have occasional severe stress where they're being chased by a saber-toothed tiger, and they're running and they're stressed out and all their hormones are up and their sympathetic nervous system is in overdrive, and it's really scary. But an hour later, if they survive, they're back at camp and they're making baskets and it's they're relaxing with their friends and it's fine, and all their levels come back down again. And of course, we know that a lot of us now are living in this state of constant severe stress, where our bodies think that we're always being chased by that tiger. If you go back to the person who actually is running from the tiger, you know that this person's running. He or she is running, and their blood is pumping, and it's going to their muscles, it's going to their heart. It is not going anywhere else. It's not crucial or vital. Their sympathetic nervous system is very active, and that person is incapable of having sex. You have to have a prominently parasympathetic nervous system in order to do most of the things that are involved in having sex. So from a biologic and evolutionary standpoint, we are not set up to be having sex successfully if we are under a lot of stress. Number 2 is take care of your body. Again, this one seems intuitive, but keep in mind that the sexual organs are like any organs in your body. They really appreciate a good blood flow. As you get older, and especially as you have poor lifestyle, you can develop atherosclerosis. Atherosclerosis causes plaque buildup. And this is, mostly associated with inflammation. So all the things that cause inflammation that you guys have probably learned about cause atherosclerosis. This causes a narrowing of the blood vessels, and as the blood vessels narrow, then you don't get blood flow to the sexual organs. And this, of course, is seen with men with ED, which this is one of the most common causes for ED, but it's also important for women. Women need blood flow too for things like vaginal lubrication and clitoral engorgement. So lack of blood flow from atherosclerosis is a big deal. So, making good lifestyle choices is the key thing. Avoiding inflammation, and you guys know a lot about this stuff, but not smoking, making sure your blood pressure is under control, making sure your cholesterol is within the optimal sort of limits, avoiding sugar, avoiding sedentary lifestyle, exercising. All of these things can be really important for avoiding atherosclerosis. The next number 3 is increased nitric oxide. So nitric oxide is the main chemical messenger that tells your blood vessels to vasodilate or open up. And actually, when you get excited, you're kind of getting aroused, your brain sends a message all the way down your body to your pelvis, releases nitric oxide, and those blood vessels open up, and the blood rushes in. And that's important. So you have to have nitric oxide. As you get older, you make less and less nitric oxide by the blood vessels. The nitric oxide is actually made by the cells that line the blood vessel. That's one of the sources in your body. It's the most common source. So those endothelial cells, as you get older, become more dysfunctional because of inflammation, and so now you can't make nitric oxide. By the time you're 40 years old, you're making about half as much nitric oxide as your 20-year-old friends. And as you can see from this chart, that number gets worse and worse and worse as you get older. So now you have this sort of double-edged sword situation where you have blood vessels that are more narrow because they're filled with plaque, and you have lost the ability to open them up, to vasodilate them, because you don't have nitric oxide. And so this, of course, is not going to be favorable to your sexual function. So what can we do about that? It's interesting, but you can actually get nitric oxide from food. You can get it from foods that are high in nitrates. So these are things like green leafy vegetables, beets, even like dark chocolate and pomegranate have some nitrates in there. And that's fantastic, but the problem is you actually need 2 things to happen in your body to convert the nitrate into nitric oxide. The first thing you need is you need to have healthy bacteria in your mouth. These are called nitrate reducers. They live in your mouth. They're one of these microbiome living bacteria. And people who consistently use antiseptic mouthwash. I just messed this up. There you go. They use mouthwash. They kill that bacteria, and they can't make nitric oxide. They've done studies where those people actually, even after a week, have been shown to have increases in their blood pressure because they don't have that vasodilation or opening up of the blood vessels. The second thing you need to make nitric oxide from food is you need to have a very acidic stomach, so acid in the stomach. So people who are taking acid blockers, especially like the proton pump inhibitors, which are like Protonix or Meprazole, or even the H2 blockers like Zantac and Pepcid, their stomach acid is affected, and you cannot make nitric oxide from nitrates. So this is really important. Like my example case, Ned, his Viagra wasn't working because he wasn't making nitric oxide. And so you can take all the Viagra you want, but if you don't have that, it's not going to help. The next one is hormone optimization. All of you know that your hormones change through time. As you get older, we tend to see reduction in hormones like estrogen, progesterone, testosterone in men and women. Women tend to start losing progesterone and testosterone in their mid-30s or about 40-year-old. And then after menopause, their estrogen levels go way down. Estrogen is really important, not only for helping you be interested in sex, but in helping to maintain the health of the vaginal tissues. So as you lose estrogen, women will see thinning of the vaginal wall. You actually get atrophy of the vaginal wall, just like you do atrophy of muscles when you stop lifting weights. And so the vaginal wall gets thinner, sex can become very painful and irritating. So that's a problem for women. With men, we tend to see decreases in testosterone starting at about age 40 or so. Again, continues to go down with age. Testosterone in men is important for sex drive, for libido, and that's what everyone always thinks of when they think of testosterone. But it's actually also important for maintaining the structural integrity of the penis. We know that men who have chronically low testosterone have been shown to have their elastic, smooth muscles in their penis replaced by fat or scar tissue. And if you don't have the elastic smooth muscles, then you can't expand the penis enough to maintain an erection. So this is a problem for men, and hormones and testosterone can be really helpful for that. Oh, and by the way, on the hormones, there's, with testosterone, there are a number of things you can do to boost your own testosterone naturally. I won't go into all of those things, but it's everything from, what you're eating to how you're exercising to how much sunlight you're getting. There are a lot of ways you can actually get your levels up naturally, and if that doesn't work, there are obviously options for replacement for like bioidentical hormones for all of these hormones. All right, stem cells. So you guys heard or you may have heard my colleague, Dr. Harry Adelson, talk this morning a little bit about how he's using stem cells for musculoskeletal pain. We can also use stem cells in regenerative medicine in sexual health. So stem cells are your body's repairmen. They're kind of your body's master cells. They're in every tissue in your body, and they're there to regenerate and heal those tissues over time. As you get older, your stem cells become less active. They're still there, but they're just not working very hard. They're just kind of hanging out, which is why older people heal much slower than younger people. So the idea behind stem cell medicine is using different sorts of biologics, whether that's platelet-rich plasma or stem cells from the patient or exosomes or various things, and injecting them into the sexual organs to stimulate the stem cells that you already have in those tissues. So we're trying to activate your own stem cells using some of these other signals. Now, of course, you can do things to activate stem cells systemically as well, and that can be really helpful. Things like exercising or hyperbaric oxygen or red light therapy or all of those kind of things where you're increasing nitric oxide is great. But if you want stem cells is great. If you want the stem cells primarily in one area, then these are potentially options for you. So there's a couple of different procedures I do. PRP, by the way, if you don't know, platelet-rich plasma, I use that with almost all my patients. That's just getting some blood from you, spinning it, getting the platelets, concentrating them, and injecting them. It's been around for 30 years, super safe, used all over the body. So that's kind of level 1. And then like level 2/3 are using your own stem cells, which we can get from bone marrow or fat, and isolate them, and we can inject those. And then the other level that's also 2 or 3, they're kind of comparable, are the exosomes, which Dr. Adelson talked about, which are these like little bubbles of growth factors and information, and they're basically kind of like the action arm of stem cells. So you can get stem cells without the actual DNA. They're kind of like these little tiny exosomes. All right, so I have a couple of procedures. In men, there's the P-shot procedure. So this is a place called Love Valley in Turkey, if you're not familiar. This is one of my favorite slides. The P-shot procedure looks kind of like this. Basically, we're just injecting into the corpora cavernosa, injecting some of these different biologics in there. Men who have the P-shots will oftentimes report things like improvement in blood flow, resulting in firmer, longer-lasting erections, improvement in sensation, resulting in more pleasure, better orgasms, things like that. For women, let's see if I can. Oh, where'd you go? There we go. This is a glacier. Unknown, we don't know where it is. They probably didn't want to tell us because we would all want to go there. But in women, we have the O shot or orgasm shot. Again, same thing. We're injecting into the clitoris and the vaginal wall. Now, in all of these procedures, this can be done under local anesthesia. Topical numbing creams work really well for this. It's actually not painful or not very painful, even though I know it sounds awful. But these can be done relatively quickly, in an office setting. With women, they oftentimes will report improvements in sensation, improvements in lubrication, as well as improvements in just general pleasure and orgasm with the O-shot. Some women will also report improvements in the symptoms of stress urinary incontinence, which is when you kind of jump or sneeze or cough and you have a little bit of urine leakage. That's stress urinary incontinence, and these can also be effective in some people for helping with that. So I treated Dave Asprey's wife. Is Lana here? She might have left. So Lana, I treated her a couple of years ago in my office, and she was fantastic, and we did one of these stem cell O-shots. And a couple of months later, I was speaking at the Bulletproof conference, and Lana marches out on stage with me, like this little badass, and she just tells the whole group about how she had this O-shot and how now she's having toe-curling orgasms, and she's so happy, and she went on, and it was amazing. And she didn't actually have dysfunction to start out with. She said everything was fine, but she did come back, a few months later and say, everything was fine before, but everything is really fine now. Like, she definitely had some improvements that she talked about openly. All right, the sixth thing is shockwave therapy. So shockwave therapy has been around for about 10 years. There are over 40-something studies on this that have been done, most of which are actually in Europe. And the full name for it is low-intensity extracorporeal shockwave therapy. And basically what this is, it's an office device that uses high-intensity sound waves delivered through like a handheld device into the penis. And what happens is, by delivering these sound waves in, you get a little bit of micro damage that releases all these growth factors, and you get increased blood vessel formation, you get increased local nitric oxide production, and you get stem cell recruitment. And in all of these studies, there's actually a really good treatment effect rate. Between about 65 and 90% of men who have ED have improvement in their symptoms after just 6 of these treatments, which take 30 minutes as an outpatient setting, topical numbing cream only, painless, no side effects, no downtime. Like, it's actually pretty awesome. So shockwave therapy is great. It's being used somewhat in women, but hasn't been studied in women, of course, but it does seem to be safe in just as safe in women as it is in men, and can be really helpful. Again, we're trying to increase blood flow, so it's all about improving erection hardness and strength, decreasing refractory period, increasing sensation and pleasure. I oftentimes will pair shockwave therapy. There's me. This is the shockwave therapy little handheld piece there. I'll oftentimes pair it with the PRP, or the stem cell injections, plus a penis pump, plus the nitric oxide boosters, plus some testosterone, plus let's work on your stress. I do it as like a package deal, but they work really well together. Ben Greenfield, you guys probably know who Ben is. He had one of these shockwave therapy treatments. It was at Gainswave, which is one of the companies or protocols in the United States. And he wrote this very famous, or at least famous to me, article that was published in Men's Health, where he talks about his grandmother. He had erections at dinner with his grandmother. It was like a whole thing. But what he said, if you guys know Ben, then that doesn't sound. He talks about how he had a lot of increase in size and vascularity, and how his wife was very satisfied, and as was he. All right, the last one I want to speak about is vaginal energy devices. This is a very broad topic, includes kind of a lot of different things. There are in-office devices, and there are also devices that you can take home with you. So the in-office devices are things like the CO2 lasers, the erbium lasers, the radio frequency devices. And the idea behind these is to use either light or heat to increase collagen and elastin production in and around the vagina, and increase blood flow to it. So these are usually 1 to 3 treatments, usually less than an hour, maybe even 10 or 15 minutes per treatment, not painful, minimal downtime. And a lot of women will see improvements in things like vaginal lubrication, improving tone and tightness, increasing sensitivity, things like that with these treatments that can be really helpful. A lot of them can also be really helpful for improving those symptoms of stress urinary incontinence, which we talked about before, which I think is really important, because there's been a long time where women who have had this incontinence, which is a lot of women, by the way, they haven't had a lot of options. Like, unless you want to have surgery, it's like just deal with it. And so there finally are some good options out there. The other things that we have are some home devices. I made this graphic myself, so I know it's kind of elementary looking, but this is a pelvic floor strengthener. There's all different types of models out there. This one actually has a TINS unit. It uses electrostimulation, and it's a home device that I sent home with my patients. It's like a parting gift, and basically it's electrostimulation. It causes contraction of the pelvic floor muscles, and it's kind of like Kegels on steroids, and it's super effective and really cool. And I give it to all my patients who are having these procedures. After I had this adorable lady she was 77 that I treated a few weeks ago. And I did this O-shot with stem cells, and I sent her home with one of these devices, and I taught her how to use it, and she was a little skeptical, but she was like, okay, I'll give it a shot. And afterwards, a couple of weeks later, she sent me this very lovely handwritten letter, and she went on and on about different things, but she says about this device specifically that it has added considerably to my joy of life, and at 77, that means a lot, which I thought was amazing. To me, what's better than that? Like, what's better than helping someone rediscover the joy of sex at any age, but especially at age 77, and making them happier and have joy? So to me, sex is very powerful, and that's just an example of that. As I wrap up, I want to kind of tell you one more story. This is a Dave Asprey story. I'm sure he's gone, but I like to tell stories about him behind his back. So Dave, when he first came to my clinic, this was 3 or 4 years ago, I think now, but he and Alana both came in, and we're getting some stem cell procedures. I'd never met him before, didn't know him at all, and he was awake for all the procedures. So I remember distinctly doing the P-shot procedure on him with some stem cells, and I remember that I had the syringe with the needle, and I'm poised to inject into his penis, and I'm all ready, and all of a sudden I looked up, and Dave has his cell phone out, and he's videotaping the entire ordeal. And then a few months later, he showed a video. I mean, he didn't like show his penis, but he shows a video of the whole thing, at one of his conferences and in front of like all these people, and it was awesome. But the story is not about that actually. So that night. So that night, after I injected Dave and Lana and had just met them, there was a dinner party that was hosted by some mutual friends. I didn't even actually know the host. They were people I didn't really know, but they're up in Park City, and it was for all of these like Park City, I'm in Utah, these Park City like health and wellness entrepreneurs, right? And so there's like probably like 25 or 30 people there. I don't really know any of them, except for I think that Harry Adelson was there with me. And of course, Dave and Lana are there because they're like the guests of honor. So Dave says to us all, he says, all right, I want you to go around the room and one by one tell me your name, or introduce yourself to the group, tell us your name, and tell us your superpower. So this whole thing starts, and the people are like, everyone's giving these like super smart, like well thought out answers. It's like this guy is like, my superpower is like is like motivation through movement, and this guy's like, my superpower is transformation through thought, and it's like all these super cerebral superpowers. Dave's power was something having to do with gratitude, I believe. So then it comes to me. And I can't think of anything to say. And so I just was like, I'll just tell him my real superpower. I'll just be honest. So I said, my name is Amy Killen, and my superpower is that I am always the first one to feel rain. Feel rain, like I can feel it on my skin before you. Not that I can like predict it or stop it or do anything, but I can feel it before you. And I started laughing because I thought it was really funny because I don't know why. And I looked around, and everyone is just staring at me. Like, no one's smiling, no one's laughing. They're just like, oh my gosh, who brought this idiot to our fancy dinner party in Park City? So it's been a few years since then. So I would like to add on to my answer. I think it's still a good answer. I'm going to stand by it because I actually am really good at feeling rain. But here's the rest of it. My name is Amy Killen. And I have discovered a secret door that uses sex and people's desire to continue to be able to have sex to facilitate education and discussions around health. This sex portal is a way in. It's an entry point that allows for improvements in self-discovery and helps motivate us towards optimal health. Sex it's fun, it's pleasurable, but it's way more than that. Sex is also more than just medicine. I believe sex is so powerful that we can use sex to educate, to stimulate, to motivate, to transform. I think at this point, it's no longer about simply reaching our sexual potential, it's about reaching our human potential. So my name is Amy Killen, and my superpower, if it works, there is a superpower, hold on. My superpower is sex. And by the way, that's also your power as well. Thank you, guys.